Guillain Barre Syndrome (GBS). It's a neurological disorder. Look at this picture, shows that affected nerves, normal nerves, MRI findings, detail going on. Introduction. Guillain Barre Syndrome is a rare neurological disorder where the body's immune system mistakenly attacks the peripheral nerves. It can cause muscle weakness, numbness, and even paralysis. Definition. Guillain Barre syndrome is defined as an acute, rapidly progressive form of polyneuropathy that affects the peripheral nerve system. It often follows an infection and can range from mild weakness to severe paralysis. Types. 1. Acute inflammatory demyelinating polyradiculoneuropathy (AIDP). The most common form in the US and Europe, characterized by demyelination of peripheral nerves. To Miller-Fisher syndrome (MFS), a rare variant that typically causes eye muscle paralysis, unsteady gait, and areflexia. 3. Acute motor axonal neuropathy (AMA) and acute motor sensory axonal neuropathy (AMSAN), more common in Asia and Latin America, characterized by axonal damage. Causes. The exact cause of GBS is unknown, but it is often preceded by an infection. Common triggers include: 1. Campylobacter jejuni infection. 2. Influenza virus. 3. Cytomegalovirus. 4. Epstein-Barr virus. 5. Zika virus. Risk factors: recent infections, respiratory or gastrointestinal. 2. Certain vaccinations. 3. Having a history of autoimmune diseases. 4. Male gender. 5. Older age. Complications: 1. Respiratory failure. 3. Residual numbness or other sensation. 3. Heart and blood pressure problems. 4. Pain, high bowel and bladder dysfunction. 6. Blood clots and pressure sores due to immobility. Pathophysiology. GBS involves an autoimmune attack on the peripheral nerves. This can result in demyelination or axon damage, leading to disrupted nerve signal transmission. The immune response may be triggered by molecular mimicry, where the immune system attacks the nerves due to similarities with antigens from preceding infections. Signs and symptoms. 1. Rapidly progressive muscle weakness starting in the leg. 2. Tingling and numbness. 3. Loss of reflexes. 4. Difficulty with facial movements, speaking, chewing, or swallowing. 5. Severe pain. 6. Difficulty breathing. 7. Unsteady walking or inability to walk. Diagnosis. 1. Clinical examination, evaluation of symptoms and medical history. 2. Nerves condition studies and electromyography. Assess the electrical activities of muscles and nerves. 3. Lumbar puncture, elevate protein levels in cerebrospinal fluid without an increase in cell count. 4. Blood test to rule out other conditions. Nursing diagnosis. Ineffective breathing pattern, impaired physical mobility, acute pain, risk for aspiration, anxiety, risk for infection. Disease management. 1. Supportive care including monitoring of respiratory function and cardiovascular stability. 2. Plasmapheresis to remove antibodies from the blood. 3. Intravenous immunoglobulin IVIG to neutralize harmful antibodies. 4. Physical therapy to help with mobility and prevent contractures. 5. Pain management, medications to manage neuropathic pain. Treatment. 1. Plasmapheresis help removes antibodies from the blood. 2. IVIG provide normal antibodies to counteract the immune attack. 3. Supportive care includes mechanical ventilation if necessary and monitoring of cardiac and respiratory function. 4. Pain management includes analgesics and medications like gabapentin. Psychosocial medicine. 1. Counseling and psychotherapy to address anxiety, depression, and stress. 2. Support groups to provide emotional support and information sharing. 3. Education for patients and families about the condition and recovery processes. Prevention. There is no sure way to prevent GBS. However, reducing the risk of infections through good hygiene practices and appropriate vaccinations may lower the risk. Guillain Barre Syndrome is a serious but treatable condition. Early diagnosis and prompt treatment can significantly improve outcomes. Ongoing research continues to improve our understanding and management of this complex syndrome. Thank you. Have a wonderful day.